Heat stress, blue collar group. Training overview. What is heat stress? Primary contributing factors. Sources of heat. Removal of heat from the body. Personal risk factors. Recognizing heat stress. Heat stress treatment. Preventing heat stress. What is heat stress? Human bodies naturally maintain temperatures between 36 degrees Celsius and 38 degrees Celsius. When body temperatures rise above this range, the body will react to get rid of excess heat. However, if the body continues to gain heat faster than it can get rid of it, the body temperature increases and the person experiences heat stress. Primary factors contributing to heat stress. The environment, air temperature, airflow, humidity, radiant heat, example, sun, or kiln. Worker, acclimatization, hydration, clothing, medical conditions. Work, your workload, your work rate are all contributing factors to heat stress. Sources of heat. The body can gain heat in two ways: generate heat itself through work activity, or absorb heat from the environment. Both work activity and the environment are important sources of heat, and sometimes work activity itself can be the main source of heat stress. Heat from activity. Light activity includes sitting with moderate movement of the arms and legs, standing, doing light work, mostly arm movement, casual walking. Moderate activity includes brisk walking, sitting with vigorous arm and leg movement, standing, doing light to moderate work including some walking, moderate lifting or pushing. High activity includes construction tasks, intermittent heavy lifting, pushing or pulling, climbing hills or stairs with heavy gear. The heat index chart is a measure indicating the level of discomfort an average person is thought to experience as a result of combined effects of the temperature and humidity of the air. Heat from the environment. The amount of heat gained from the environment, external heat, depends on the surrounding air temperatures, the amount of air movement, and any radiant heat. Some examples of radiant heat sources are heaters, boilers, fires, sunlight, reflected from the ground. Removal of heat from the body. The body has two main ways of getting rid of excess heat: sweating, increasing blood flow. The heat equation: high temperature plus high humidity plus physical work equals heat illness. When the body is unable to cool itself through sweating, serious heat illnesses may occur. The most severe heat-induced illnesses are heat exhaustion and heat stroke. If left untreated, heat exhaustion could progress to heat stroke and possible death. Personal risk factors. Lack of acclimatization. Conditioning of the body to a hot working environment is known as acclimatization. A person who regularly works in a hot environment will be at lower risk of developing heat disorders than a person who does not. Personal risk factors. Poor physical fitness. Physically fit people are generally better able to cope with heat stress and are less likely to develop disorders. Regular aerobic activity such as walking, running, cycling, or swimming can increase a person's level of physical fitness. Personal risk factors continued. Obesity, increased age, pre-existing medical conditions and treatments, short-term disorders and minor illnesses, chronic skin disorders, use of medication, use of alcohol or drugs, previous heat stroke. Recognizing heat stress. Heat cramps, sign and symptoms, muscular pains or spasms, excessive sweating. Heat exhaustion, signs and symptoms, shallow respiration, increased respiratory rate, weak, rapid pulse, cool, pale, clammy skin, sweating, weakness, fatigue, dizziness, headache, nausea, fainting, muscle cramps. The signs and symptoms of heat stroke include hot, dry, flushed skin, absence of sweating, agitation, confusion, decreased level of consciousness, headache, nausea, vomiting, seizures, increased respiratory rate, irregular pulse rate, shock, cardiac arrest. Heat exhaustion, moist, clammy skin, pupils dilated, normal or subnormal temperature. Heat stroke, dry, hot skin, pupils constricted, very high body temperature. Heat stress treatment. Heat cramps and heat exhaustion. Move the worker to a cooler environment. If possible, lay the worker down, remove or loosen any tight-fitting clothing. Cool the worker down by sponging with cool water and fanning. Take care not to cool the worker too much. If they start shivering, stop cooling. If the worker is fully alert and not nauseated, provide oral fluid, such as juice or other non-caffeinated, non-alcoholic beverages. Heat stress treatment. Heat stroke. Heat stroke is a life-threatening medical emergency, and the patient is in the rapid transport category. Maintain the airway, breathing, circulation as required. Move the worker to the coolest possible place. Lay worker down on their back unless they're actively vomiting or having a seizure, then place them on their side. Remove all outer clothing and apply cool water by either dousing or applying wet, cool sheets. If the worker is fully alert, not nauseated, provide oral fluid, such as juice or other non-caffeinated, non-alcoholic beverages. Have the person lie down. Apply cold compresses. Use a fan to lower temperature. Elevate feet. And give fluids when possible. Heat rash. Prevention. Avoid repeated exposure to heat. Change clothing often when sweating. Wear clean, light-colored, loose-fitting clothing made of a breathable fabric. Treatment. Leave the hot environment, preferably until the rash is healed. Keep the areas clean, cool, and dry as much as possible. Preventing heat stress. Learn to recognize the key signs and symptoms of heat stress in yourself and coworkers. Acclimatize your body. Drink plenty of water. Avoid caffeine and alcohol. Take rest breaks in a cool, ventilated area and allow body to cool down before beginning again. Schedule work to minimize heat exposure and try to do the hardest physical work in the cooler part of the day. Allow for slower paced work during the hottest periods of the day. Move or relocate the work away from direct sunlight or radiant heat sources whenever possible. For outside work, schedule routine maintenance and repair work during cooler periods of the day. For inside work, schedule routine maintenance and repair work for a time when hot operations are shut down. For more information, the information and guidelines provided were obtained by WorkSafe BC. For more information, please visit WorksafeBC.com.